So the consultation process is really learning about the patient. And a lot of that is also the cancer management. And then we get to talk about goals. What do you want this to look like when you're done? There are many different options when it comes to breast reconstruction. A lot of these options are dependent on the size of your tumor, what kind of mastectomy you're having, or whether it's a lumpectomy, and what your goals are. Almost always, there are many different ways to approach the breast reconstructive patient based on her goals. Patients always want to know, what's the best procedure for me? I will tell you, 9 times out of 10, it's using your own tissue. Microsurgical breast reconstruction has numerous benefits that implants cannot offer. There are some patients that for any variety of reasons would prefer an implant-based reconstruction, but if you look at the risk-benefit profile across both types, almost always using your own tissue is superior because it's not a foreign body, it's not a breast implant. Preparing for surgery can mean a lot of different things. Definitely make sure that you've met with your primary care doctor. We want to make sure that your heart, lungs, and your body are healthy enough to handle the anesthesia so we can get you through surgery safely. Recovery after surgery can often be really intimidating. Don't worry, I have everything typed up and you'll have all of the numbers and resources that you need. So you can always call the office and we can email you a copy whenever you need it. You will be walking. You're showering by the time you go home, but I want you to take it easy. I don't want you to engage too much of your core or your upper body. At the 6-week mark, assuming you're all healed, I let you go back to life and all the things that you like to do. But you can't go 0 to 100 overnight. You have to work your strength back up to what you were doing before. It usually takes closer to the 12-week mark before you feel back to normal. Recovery is different for everyone. And if you feel like something's off and maybe you're not recovering as quickly as you need to, give me a call and let's talk about it. Anytime you talk about surgery, we have to talk about the risks and the benefits. When it comes to implant reconstruction, we always worry about infection. I will make sure that you get antibiotics during surgery, you will get a prescription for antibiotics after surgery, and we'll give you a very specific list of signs and symptoms to monitor for. Now, if we do deep flaps, sometimes you can get little areas of wound separation or wound healing delays. Most of the time it's easily managed, a swipe of Neosporin and a Band-Aid and it should heal right up. And I revise any of those issues at a second stage for revisions should it be necessary. I think what's most important to know is that if you think you might need radiation or you have already had radiation, you are robbing yourself of the best possible reconstructive outcome if you don't at least meet with the microsurgeon. And not a microsurgeon who maybe does this once in a blue moon, a microsurgeon who does this every day. Because you may need the fancy operation. You might need the little bit more complicated operation. It's not just about stealing from Peter to pay Paul. You gotta mold it. You want it to look like a breast when you're done. You want that tummy that you took it from to look identical to a cosmetic tummy tuck. If you're not getting that result or you're not confident you're gonna get that result, you need to see someone who can provide you that.